Good evening and welcome to yet another episode of the Health and Wellness Show. My name is Chebet Birir na kama kawaida, this is where we inspire you, we inform you and we empower you to take full control of your health and live your best life. My name is Chebet Birir and today we are talking about a very sensitive topic, that is leukemia. Leukemia is a cancer of the blood and it affects your blood and the bone marrow, and it actually affects many children. About 30% of the cancers in children that are diagnosed every year are accounted to leukemia. So it's a very important topic that we need to discuss. And with me on set, we have Elo Mapelo, who is the founder of Henzo Foundation, which is an organization that, helps patients with leukemia to manage their conditions and live their full lives. Karibu sana, Elo. Another guest is Nancy Wanjiru, who is a mother to a daughter, an 8-year-old girl who was diagnosed with leukemia, and she's going to talk to us about the challenges since the diagnosis and also how we can help the daughter to get a bone marrow transplant in India. Karibu sana to the show, Nancy. So let's just dive right into what exactly is leukemia. And I know both of you have an experience and you can be able to tell us in your own eyes, what is leukemia? Let's start with you, Elo.
Thank you very much, Abed, for this very timely conversation. And I'm saying so because this is the time that we focus on leukemia awareness. This has been the Leukemia Awareness Month. Leukemia is blood cancer. It affects the blood and, of course, like you said, the bone marrow. And that's because the blood cells are formed at the bone marrow. Unlike many other solid tumors, leukemia and other blood malignancies, very difficult to detect and very difficult to treat, therefore. And that's one of the things that we want to speak about during this time of
awareness
of leukemia awareness.
Yes.
Because many people will be presented to the doctor when it is extremely late, because it doesn't present like anything specific. It presents like you'll say malaria or some other condition. Because by the time someone gets to know it's leukemia, they will have been treated for the fatigue they have. They've been treated for loss of blood. They've been treated for distended spleen and liver. Those are some of the conditions. So some of the symptoms of leukemia, which are not anything specific, really.
All right.
What makes someone actually get into treatment for leukemia is diagnostics. When the doctor sees those various kinds of symptoms, then the patient has to be sent to the lab for the doctor to know that this is actually not A, it is B. It is not some, just some general condition. It is leukemia.
Okay.
And therefore the reason to do this awareness so that we can get more people
to understand
seek
treatment early.
Yeah, and so that they're able to get to treatment early.
Okay. Thank you so much, Elo. Nancy, before your daughter was diagnosed, what did you know about leukemia?
Thank you so much, Chebet. What I would like to say about this disease called leukemia, first, I never thought it affected children. So I thought it was for the elderly and the old generation, not small children. Yes, that's the newest thing that I learned about leukemia.
Yeah, but apparently it affects more children than adults. Is it right?
Yeah, there are some kinds of leukemia, like the acute leukemias, and I suspect maybe that's the condition.
Sure.
They mostly affect the children. The acute leukemia.
Okay.
There are 4 broad categories of leukemia. There's 2 that are acute and 2 that are chronic leukemia. Maybe I can speak to that as we progress.
Later. But let Nancy tell us now. Your daughter, who is now 8 years old, Lynn, what made you go to hospital, and how did you realize that she had leukemia?
Yes, now Lynn is a jovial girl, a very talkative girl, vibrant, and a girl who can stand for herself. So the changes came in late last year. the month of December.
Okay.
She started having those changes of withdrawal, and she could just keep quiet. And now that they are very close with the brother, the gap in between her and the brother, we thought that she's either quiet because I'm taking more time with the brother, because she could just get into the house and get quiet. Within no time, so much had changed with her. The walking style. She couldn't walk straight. And I got concerned. I remember we went home for the December holidays, and my mother was concerned, and she was like, have you noticed that Lynn has changed? And I was asking, yeah, she's changed. She has just been quiet. And she was like, have you not noted how she's walking? And come January, we decided now to start the treatment. What were we treating? The pains. The pains. Because she was saying she was complaining of pain. She can't move from one place to another because they opened the school at the mid-month. Okay. So I was thinking maybe during the December holidays when she was complaining of fatigue. No, she was not even complaining of fatigue. The consistent was pain on the legs. Okay. When they opened school, the third week, now after the first week of open, the third week of January, now she couldn't really walk nicely. It changed. Everybody was concerned, including the teachers. And they were asking, what happened during the holidays? She was walking nicely when she left. When she's back, she can now walk. We did x-rays. We did all what we could do, including the test and everything, but we could see anything. So it was on and off. March.
March of this year?
Yes, March of this year. We did the second x-ray and nothing could show. Now we decided to be changing hospitals. We thought maybe the x-ray in this hospital is not as good as this one. So we started changing. So it could go away. We were suppressing the pain. Later to know it was the lymph nodes. They had affected the lymph nodes that she couldn't even step her feet down. There was that 1 week she couldn't go to school because the school she has to take the stairs to her class, which is second floor, and she couldn't reach there. And she was complaining. When I pick her in the evening, she could tear. And I was asking, what's the problem? Mom, I can't walk. And I'm telling her we were in the hospital and we can't really see what the problem is. Until now, the time we decided now to check on the blood. Okay. And we did now the full hemogram. For the first time in the month of March, because we did it, the blood was okay. It was okay. The month of March, it was okay. And the first week of April was okay. It was until after Easter when we noted now the red cells, the white cells, the platelets, everything was abnormal. Yeah, the white cells were very high. The platelets were very low. And the red cells were extremely low. Okay. Where she got very weak, lost weight. From the month of March to now May, she had lost around 10 kgs, more than 10 kgs, where it was a concern to everybody. What's happening? We can't see where the problem is, but she's just losing weight every day.
Was she eating?
No, the appetite just went away. Okay. You know, it's a problem to a mother. When you go to a hospital, you can't tell where the problem is. The disease is not there. She can't eat. She's getting weak. And then now she became pale. The month of April, she looked very pale, which, because I'm not a medic, I could not tell. Now we're talking mid April. That was after Easter holidays. My mother-in-law came to visit us during that holidays, and she was very concerned because she did the massage, the questioning to know what could have happened, that she can't now even walk straight. She couldn't walk, she couldn't eat. Everything was just slow, and she lost a lot of weight. It was a concern, and she told us, now you have to do the blood work again.
And then you did the blood work?
We did it. It now showed, now the red cells are lower than they were the first week. The white cells are very high. The platelets are even lower. Now she looks more pale. We sorted the advice now from a pediatrician, and we took the results from these different hospitals. Remember when we visited one hospital and we could tell something is not okay.
Yes.
After taking the antibiotics, we could change.
So they were,
take the
in the
tests.
first hospital they treated you for an infection?
Yes, it was an infection.
It was an infection.
Because we couldn't see
Yes.
where the problem. The blood is okay. We can't see any fracture. There's no dislocation. There's nothing. So what they do, the assumption is maybe there could be an infection. So they were treating an infection. When we sought the advice of the pediatrician, she told us we have to be on a higher dosage of antibiotics for 10 days. And she told us if nothing changes, we will have now to rule out there's a problem.
Okay.
I know she knew. So she gave us the 10 days.
And
so
then after 10 days?
After the 10 days, I remember it was on a Tuesday, we went there, and now everything is even worse. Now she has really lost weight. She's more pale. And now they had to break the news to me and the father that, yes, they had hinted that now before the 10 days, if things will not have changed after the 10 days and the high dosage of the antibiotics, there'll be a likelihood that she could be suffering from leukemia, which I was like, it's not even in our family. Neither of our families. Where could this disease have come from? And I was so much in faith of this high dose that it could work, because there's no trace of such disease in both of our families.
Yes.
So come the 10th day, and I drop the children from, pick them, take them to the house, take Lynn to the hospital, and now we are with the pediatrician here. And she asked me of the results, because we had to do the blood work before we see her. And she now compares. She makes me go through the post and the pre results. And she's telling me, do you see any difference between this? And I can tell her, yes, I can see the R things are very low. And have you noted some changes with Lynn? Yes, she's more pale than she was. And now she's trying to break the news to me that what we had suggested it could be, it really is. which was not
What you
a good
expected.
experience
Yes.
for me to.
How we'll come back to you about now how you felt and the challenges that you've been facing since then, and I'm so grateful for your courage to come and speak about it on the show, and I really hope that Lynn will get the support that she needs.
Thank you.
But now let's talk about the symptoms, Elo. First of all, is it genetic? How does it start? And then what are the symptoms of leukemia and what are the treatment options?
It is not hereditary because, as you've heard, she said that
it does not run in
it doesn't run in the
family,
family,
both
so
her
they were
families.
surprised that where did it come from. It is not hereditary, but the way it develops is fairly unknown, really, because from all the texts and all the literatures that we have, we haven't pointed out that to something specific, but it happens. The symptoms, like she has said, may not be very specific at first, because when someone is having pain, you cannot really point out to it being leukemia at first. That's why she was being treated for various other things. For infections, and of course the pain, and maybe at some point, maybe she was even given a hematinic. Maybe some are even given, because when one becomes pale and they notice that the HB is going low, then one thing they are given quickly is something to boost the the blood. So it and in her case, it took almost 6 months, 7 months before they finally came to the diagnosis of it being leukemia, because like I'm saying, those are not very specific symptoms. Blood loss, weight loss, pain in the lymph nodes, in some cases distended liver and the spleen. Those are most of the presentations that we see.
Okay.
And it requires someone, a clinician who has a curious eye, to know that this thing has been along for some time.
Yeah.
It doesn't go off with the first line of treatment, which in most cases is antibiotic. That is when now they send them to confirmatory tests. Because the first tests are usually blood picture, a total blood count. They want to see the blood count, how are the platelets doing, how are the white blood cells doing, how are the red blood cells doing, and that's why now they pick up the need to want to go and do further testing to confirm, because if the white blood cells are high, then you suspect this could be some infection. You put the patient on an antibiotic. For some time they're not responding. You probably change the medicine that you're using to use a stronger one, and they're not responding. Then the quicker you get to the thought of now trying other tests, the better for the patient. And in our case, I think it was fairly fast.
It was fairly fast.
Yeah, because I've come across cases of
many
people
patients
waiting for up to 2 years. I mean, they've been suffering for almost 2 years, and they're not able to come to
point at what they're suffering from. Until
it takes time. It takes time for them to come to that diagnosis.
Okay. Yeah. Now, you interact with many of these cancer patients. What are the treatment options and what exactly works? I know there's chemo, there's some drugs that you'll talk about, and there's the bone marrow transplant.
Yes.
And we have about more than 1,500 people dying from leukemia in Kenya every year. And of course, now this needs to be addressed. So please tell us, what are the best treatment options and how can these patients access them?
There are like 3 major. First is chemo, and that's for especially acute leukemia patients. They have to use chemotherapy. It's a mixture of anti-cancer medicines, which they have to be injected in the hospital. Therapy, but this one is not effective in acute leukemia cases. is active in chronic leukemia cases. And in this country, we have a program that treats chronic myeloid leukemia, which is one of the chronic leukemia cases. And the program provides free treatment to patients who are in that category. And of course, the third choice of treatment, which is the best choice, obviously, being that it is most expensive, then it is out of reach to many, is bone marrow transplant. In most cases, bone marrow transplants are done out of the country.
Yes.
I think it's only 1 or 2 cases I've heard that was done in the country. But the cost comparison was not very...
There was a disparity in the cost between here and abroad?
Actually, it was more expensive here than abroad.
It was more expensive.
Yeah,
okay.
you will expect that the fact that it's being done in the country, it might end up being cheaper.
Yeah.
But it wasn't the case. So, and I think that's probably why the hospital that was that did the first few is having difficulties in continuing to do the same. So most patients end up going outside. I think it's cheaper there probably because there are many options, there are many hospitals, there are many doctors who are able to do that, which is also something that we need to look at,
and we'll come back
probably
to
discuss that later.
We'll
so those are the three main approaches to treatment.
So chemo, the drugs, anti-cancer drugs, and bone marrow transplant.
Bone marrow transplant.
Okay, thank you, Daktari. So Nancy, tell us how has it been? How has it been since Lynn was diagnosed with leukemia? What treatment options have you been exploring, and how far are you now?
Yes, no. It has really changed our lives a lot. Personally, as a mother, as a family, as a community. First, I didn't know it is a painful experience. I didn't know. I usually hear that people say it's cancer, you go through pain. I've experienced that pain. Her life has changed drastically because now she can't keep up with the school life, the normal life, the social life. Now that she's a high-risk girl, her immunity goes very, very low. So her mingling, it's not as it was before.
Okay.
It was diagnosed. She can be in school. So she has dropped school until the day she'll be well. She can go to church. She can interact with her friends because we really don't know who is sick and who is not sick. In the month of May, we started the treatment with her state. We started directly with chemo. And yes, we've seen the effects of chemo that has really changed so much.
What are some of those effects?
The effects of chemo, the major effects of chemo, first it's pain. Even without anything else, it's pain itself. And it targeted her tummy. She has been in a lot of pain. Even now, when she's in the house, she'll complain of pain, a lot of acid in her tummy. The blood, we've done multiple of transfusion. Anytime she went through the first month of May, June, we did a whole month of treatment, oral injections and so. And it affected her blood. We have done around 4 transfusions and platelets. Her platelets, I remember the day we were discharged after chemo on a Thursday. And on a Sunday evening, she was not well at all. Little did we know that it was platelets that were affecting her. Leukemia it's one of unpredictable diseases that you can suffer from. It will never tell you it's coming to hit. It was on a Friday morning. She was very happy. She has been away from home and she's home. She's going to be with the siblings. Come Sunday evening, she's so unwell, very, very sick. Monday, we think it could be now we've changed from the hospital setup, we are home.
The home
Could be the
environment.
transition. And now she's vomiting, she's diarrheaing. Tuesday, it can't stop. Monday, we consulted with the doctor, and now we are putting her on this medication to stop the vomiting and the diarrhea. On Tuesday, it can't stop. She can't be away from the washroom. It's very, very watery, like things are changing very, very fast. On Wednesday, remember we've been discharged on the Thursday evening. On Wednesday, we are back at the hospital, weaker than she was after chemo. She has lost a lot of water. Her HB now is down, the platelets are down, the urine, the stool. She's even was bleeding. The urine, the stool has blood. It was a bad experience because when my doctor came, I was telling her, everything looks reddish, brownish, and even she's nose bleeding. And she was like, she stopped everything. For me, I thought it is maybe there clots inside
The body.
because of the chemo.
Yes.
Only to be told it has been an internal bleeding that maybe happened on a Monday and a Tuesday. And now she has lost the platelets and the blood. It's now
Clot.
an urgent appeal
Yeah.
for people now to come to donate blood and the platelets. That's how things have changed. With Lynn, she's that fragile, you don't know what will happen the next minute.
And thank you
The diet, we've changed the diet because we have to keep off the wheat, even in the house, the sugars. So our whole life
has changed.
has changed.
And thank you so much for your strength. I mean, Lynn is also such a fighter. I've interacted with her a bit. She is strong and she's very jovial. You can't actually tell that she is unwell. And we really hope that you get the support that you need. So we are going to take a short break. And when we come back, we'll actually have Lynn on set. We'll be able to talk to her a bit. Don't go away. Welcome back. If you've just tuned in, this is the Health and Wellness Show, and my name is Chebet Birir. We are talking about leukemia and the diagnosis, the treatment, the symptoms, and of course on set we have Nancy Wanjiru, who is mother to Lynn, who has just been diagnosed with leukemia, and she needs the support for treatment, that is a bone marrow transplant in India. Thank you so much, Nancy, for joining us. We also have Elo Mapelo, who is a pharmacist and founder of Henzo Foundation. It's an organization that helps cancer patients with the support they need through treatment and management of their condition. Karibuni sana to the show, and thank you for joining us today. It's a heavy topic, but I know that we have to talk about it to raise awareness and, of course, the support that Nancy and her daughter Lynn needs. So before we went on a break, we were talking about the challenges that Nancy and her daughter Lynn have been facing, and the treatment options that they've been interacting with. And we'll come back to you, Nancy. But first, let's talk to Elo. Elo, you've interacted with many leukemia patients, and we were talking about the treatment options, the chemo, the drugs, and of course the bone marrow treatment, which is out of reach for many patients in the country. Now tell us, what are the alternative support systems that you give to patients? Apart from treatment, of course, there's the mental anguish that comes with the diagnosis, and as you can see with Nancy and Lynn, her daughter, what kind of support can you give to such patients?
Yeah, thank you, Chebet. Henzo Kenya is an organization, like I said, that was started many years ago. almost 19 years now, to provide support, psychosocial support, especially to patients who are undergoing one type of the leukemia, chronic leukemia called chronic myeloid leukemia. But over the years, we've realized that there are more people who need that kind of support. And we've opened our doors to accommodating people who are going through treatment for other types of leukemia. There are other types of acute leukemia, for example, that they don't have a way to interact and to share their stories, to share their experiences, and to have that kind of an avenue to get psychosocial support. So we do that, and we've opened our doors to that. And we work closely with our doctors, because it's the doctors that will be able to direct the patients to where we are. And just about 2 years ago is when we started accommodating patients with acute leukemia and other blood cancers that are not chronic myeloid leukemia, which we started with. Now, for chronic myeloid leukemia, let me just say that just a little bit, because there's an interesting story to it.
It's okay.
We have a program that runs in this country that helps to provide medicines for them, and they get the medicines given to them free of charge, and the medicines are very effective. Just yesterday, we were in Nairobi Hospital celebrating the World Chronic Myeloid Leukemia Day, which is a day that we just set aside to celebrate the successes that we've seen in development of therapies that are effective on chronic myeloid leukemia. But even as we do that, we also do a lot of advocacy work to try and help the government and other people to try and get other therapies that are effective in other kinds of leukemia. Acute leukemia is difficult to treat, like you've heard, but we want to make sure that we are able to work together with the pharma companies, like we've done with chronic myeloid leukemia, and also with the government, to make sure that treatment is within reach to many people. We had a lot of conversation with the Social Health Authority, and they increased their allocation for cancer treatment from 300,000 to 550,000, which is a big win for us. Recently, the Cabinet Secretary for Health launched new rates for people who are going outside to get treatment, and it was capped at a figure that was fairly low. We are still trying to push for that, because if Lynn is to go to India, for example, the government through SHA will only pay for I think about $500,000, and we are advocating to make sure that that figure is increased to an amount that at least will be able to take care of even if it's half of the cost of the treatment, because it is very difficult to do fundraisings. I can tell you, Chebet, in my phone, I'm in various groups for people who have leukemia, who need money for treatment. 7 million, 8 million, some hospitals maybe it's about 4 million, but still in the millions. And they need to raise that money. It's not easy for us to keep raising that money. We thank God for the spirit of Kenyans, because somehow we manage. But we don't want to always depend on that goodwill that may not necessarily be available all the time. While the government has a provision for that through SHA. So one of the other things that we do as Hands of Kenya is advocacy. And that's how we managed to work with other organizations that are active in cancer control to advocate for that increase in cancer care package. And we will still keep pushing for patients like Lynn to get a better cover when they go to India.
Because in this case now, this is a young girl with dreams and ambitions. And
absolutely.
If the government can do that, why not? And thank you so much for the advocacy efforts. And I hope that the government will surely listen and subsidize these treatments for leukemia patients.
Absolutely.
All right. Nancy, you're talking about the challenges that you've been facing with Lynn. And thank you so much for being strong. And for just being there for your daughter. Please tell us, what do you need to be able to treat Lynn, and so that she can live a full life, she can go back to school? I understand she's out of school now. So what do you need so that she can go back to school and continue to enjoy her childhood?
Well, thank you. We started on chemotherapy, and I really think it has stabilized her. I won't deny that it has really stabilized her, but we really need a permanent solution to this problem. That's why we have the thought and the idea of bone marrow transplant, where the whole system will be changed, and we'll work now on how to stabilize the red cells, the white cells, and the platelets from the root cause. Okay. And there's the bone marrow transplant, where even we've looked for a donor between the siblings, and we have identified a donor. So if I get the chance to get and raise enough funds to take her to India, I will do it sooner, so that when we are starting the next cycle, we'll do it in India. Okay. That is my dream.
It is my dream too at this point in time. Have you identified a hospital, and what are the costs that you will incur in that process?
Yes, we've sourced for different facilities in India, where we've seen the Apollo and the Fortis. They are among the best, but very, very costly. And here we are, we've already spent some substantial amounts in millions too, here at home.
Yeah.
So we had to sort for a very accommodative budget that we have, and we've seen the Ashoda, which is in the state of Chennai, which will be relatively, it's equally good as Apollo, but will accommodate the budget.
Okay.
Yes.
You'll tell us the pay bill number and the pay bill number as we head towards the end of the show. But Elo, please tell us, do you support, I know you've talked about being in many WhatsApp groups where you support patients financially. I mean, not you, but the contributions from Kenyans. So what is Henzo doing in terms of finances to support these patients? And if not, what support does the organization need so that you can be able to reach more patients with the support that they need?
Yeah, currently what we are able to give to patients is transport support to go to hospitals within the country, though.
Within the country?
Yeah, because we know it's a really big call to get enough funding to help patients who need treatment abroad, like clean. But we are always out there asking for that kind of support. And the best we can do is probably once maybe we even get a contact, we'll be able to share it within our circle and get people to help. Yes. But what we are able to do as an institution, through the support of one of our partners called the Max Foundation, is provide transport to patients locally, which is still a very big need that many people don't have. So where there is such kind of need, we are able to reach out and help the patient get to where they can get their medicines, and they can get their diagnostics and so on.
Okay.
But of course, we are always hoping and working towards building a fund that will help. I know there are organizations that we work closely with that have a bit of that. An organization like Faraja does help patients a bit. I don't know if you've been able to interact with Faraja. Maybe not to the tune of the millions or the hundreds of thousands, but in a small way. But it is that small bit that we put together, and hopefully it will come to be of help soon.
Perhaps maybe after this, Nancy will get in touch with you and join the organization for better support. 20th September, you marked the World Leukemia Day.
Yes.
Tell us how it was and what came out of it.
Yeah, that was yesterday, 20th September. World Chronic Myeloid Leukemia Day is observed on 22nd September. We decided to do ours earlier because it was a Saturday. We wanted to have a time that we can be able to come together. And it is one of those days that most chronic myeloid leukemia patients look forward to, because it's an opportunity to come and interact with people who you started the journey with. Like I said, there are patients who have been on treatment for 15 years, some even 20 years, that were in the meeting yesterday. And they've been getting treatment for the last, for that, that period of time. And this treatment is free of charge. It is made free by the various partners, including the Max Foundation that makes medicines available here, various pharmaceutical companies that provide the medicines, big pharma companies that just put aside a certain amount of medicine to be given to the patients for free.
For free.
And these medicines are not cheap, because 1 month course of chronic myeloid leukemia treatment is worth about 300,000 to 400,000. So you can imagine someone who has been on it for 10 years, if they were to pay from their pocket, that will not be affordable to anybody in this country, really.
And I was talking to Nancy, and she was telling me that they've spent a lot of money in hospital and with the drugs. So what is the criteria for you as Henzo to help patients like Lynn get that free medication? Is there a way that Lynn can now start getting the free medication from Henzo?
So now for Lynn, Lynn's case is acute leukemia.
Yes.
And the medicines that we have is for chronic leukemia.
Myeloid leukemia.
So that's where the difference is.
Okay.
That's where the difference is. That's why I'm saying for patients like Lynn, the best we do as an institution is to help them reach to the hospital. We provide fare for them.
Okay.
Connect them with other organizations. Like there's 2 or 3 organizations that have some support for children. But still very minimal, really, considering that you're actually looking at millions right now.
Yes.
So that our biggest shot at helping acute myeloid and acute lymphocytic leukemia patients like Lynn, our best shot is the advocacy work that we've been doing.
The advocacy work.
Yeah.
And thank you so much for the good work. Now, Nancy, how much does it cost? How much will you need to go to India and back for the bone marrow transplant, for the admission, for the treatment? How much will you need, and what is the pay bill number?
Yeah, thank you for that. Having compared the different facilities price range, it will range from between 7 to 12 million.
So let's say 12 million on the higher
Yes,
end.
on the higher end, but not less than 8 million. Because they'll have now to start all over again on the other end, do their own tests, which are very expensive here.
Yes.
We've done them here, sent to India. They'll have to be redone again. So when we are away from home, getting the treatment, they'll recognize that we've started the treatment here, but they'll also will have to incur the cost on the other end as they do their test and everything else. So the cost can't be less than 8 million. 8 to 12 million. So our budget, if we look at our flyers, it's 9 million, but we target between 8 to 12 million.
8 to
that
12
will
million.
really help us through. We've come up with a pay bill because, of course, it has not been easy. We've still been lobbying and working closely with friends who have really come through for us and the church.
And how much have you raised so far?
We've raised 3 million, which we've depleted. That people can't believe that we've really spent that much. The tests themselves that we've done severally. The first test I remember, which I took it at Aga Khan. It costed me around 50,000. 50,000. We've done multiple of them. We've been in and out of the hospital. As I was telling you earlier, from the month of May, it is our first time to be away from the hospital for more than a week.
Yes.
So we've been in for the treatment. And because of immunity, We couldn't handle her in the house. We find ourselves back at the hospital. May, June, July, August, we've been at the hospital. It is costly. Where SHA has come in twice and it failed to work 2 times when I was there. I broke down when I was at the cashier and they were telling me, you have to pay it cash. And it was 420. Paying for the treatment, for the bed, for the medication, which is expensive.
Yes.
So we've really spent close to 2 million shillings, not counting other
extra
costs that come about. And our pay bill, it's 400, 200.
Pay bill 400, 200.
And the account number is 511417.
511417.
Yes.
If you have something small, please feel free to support Lynn through her mother, of course, Nancy. Again, the pay bill is 422
400
400
200.
400 200 400 200.
Yes, 400 200.
And please repeat the account number again.
Account number is 511417 511 417.
Okay. Thank you so much, Nancy, and I really do hope that Lynn will get the treatment that she needs. Now, we are wrapping up. We only have about 1 minute to go, so I'll just allow you to give your parting shot, Elo, and then Nancy, and then we close the show. Elo.
Yeah, thank you. I think this will probably be the best opportunity for me to say that the government has done well in putting aside some funds for patients who need to go outside for treatment. I think it's the first time they are, formally doing that. I'm sure with that arrangement, then Lynn will be able to get about 500,000 shillings from SHA. But also to say that looking at how big the burden is.
Yeah, 12 million
minus 500,000.
We still have a huge burden.
There's still a big, very, very big burden. So here is to ask the government to really look at their math, see how practical that support is, and consider increasing it. Because that huge amount of money is what Kenyans try to raise in their various groups that they are in, but you don't always get very successful. Sometimes we are lucky, but we are not always so.
Thank you, Elo. And maybe in the last sentence, how can leukemia patients reach Henzo?
Through our socials, they can get to Henzo Kenya across all social media platforms. They can also reach us through our number. Can I say our number?
Yes, please.
0722
0722
242
242
766.
766.
Yes.
If you're struggling, please feel free to reach out to Elo and, of course, the Henzo Foundation, and we will be able to receive the right support that you need, at least. Thank you so much for tuning in. Nancy, just your parting shot as we close.
Thank you for giving this chance to us, Chebet. I'll ask the government, now that they've promised to come through for patients like Lynn, let it be known that it's truly working through her case. If they're going to chip in, as they have promised, let Lynn be a true testament that they are coming through for children, and let it be tabled in the parliament, because lots of us are suffering because of the cost.
Thank you, Nancy. That's it from us tonight. Thank you so much for tuning in. Of course, we've talked about leukemia, the challenges, the symptoms, and the treatment options. It is a tough diagnosis, but remember that it is not the end of life. There is hope. Please feel free to reach out to people like Elo here with the Henzo Foundation, and you'll be able to get the right support. And of course, the bigger call is to the government to be able to chip in a big way to support patients with leukemia. Thank you so much again for tuning in. My name is Chebet Birir. See you again next week, God willing.